which are the occiput, frontal, the sphenoid, and the ethmoid, a contribution from the ethmoid. So that's what makes up our neurocranium that houses up the brain. What I'm going to do is just start a review of probably the most difficult one, which is the temporal bone. And as I explained to you, as I told you last week, there are basically 5 parts to the temporal bone. We have the petrous temporal bone, of which there is a part of it that shows up on the inner aspect of the skull, and that separates the middle cranial fossa from the posterior cranial fossa. This is the petrous temporal bone. You can see it superiorly as well as inferiorly. So inferiorly here, the petrous temporal bone is wedged between the sphenoid and the occiput, basically, right? And inferiorly, we have it here between the greater wing of the sphenoid and the squamous part of the temporal bone and the occiput. So all of this here is petrous temporal bone, all we're seeing here. Now, there's also the mastoid process here, and we have the tympanic part of the petrous, tympanic part of the temporal bone. Is that better? And the last part that we have is the styloid process, which was broken off in this one, but it's right in front of the stylomastoid foramen, which is right here. So we expect the styloid process to be here. Remember, the styloid process has 3 muscles coming off of it: the stylopharyngeus, the styloglossus, and the stylohyoid muscle. Right? Okay. So if we start with the mastoid process, remember that as a neonate or newly delivered baby, this process is missing, right? There's nothing here really. It's just what we have is the squamous part of the temporal bone, the petrous part of the temporal bone, and this sort of grows out of the petrous part of the temporal bone, right? Okay. So most people list it as another part of the temporal bone. So we have the petrous temporal bone, temporal mastoid process, squamous temporal bone, that's this big area here, right, which also has the zygomatic process of the squamous temporal bone forming the zygomatic arch, right? And then we have the tympanic bone. The tympanic bone here, let's start with that first. That forms a U-shaped structure here, you can see it, U-shaped structure. And this is the external auditory meatus, right here. That's an external auditory meatus, the bony part of it. There's a cartilaginous part, which we're going to be doing when we do the ear. But the bony part has the tympanic part of the temporal bone, right? Called tympanic plate. That's this whole area, and forming the U. And superiorly, we have the squamous temporal bone forming the upper part of the bony part of the external auditory meatus. If we go anteriorly to the tympanic part of the tympanic plate of the temporal bone, we see this fissure here, which is called the squamo, because all of this is squamous part of the temporal, squamo-tympanic fissure, right? And as I mentioned last week, there's a small piece of the tegmen tympani, which is really a part of the petrous temporal bone, right, which forms the roof of the middle ear, that comes down and lodges itself anteriorly here in the squamotympanic fissure, and is going to divide this squamotympanic fissure into a this is petrous bone, with a petrosquamous fissure and a petrotympanic fissure. So let me just see if I can show them to you here. Petrosquamous fissure, this little one here, that's where the capsule of the temporomandibular joint is attached there, along there, one of the attachments, and the petrotympanic fissure through which comes the chorda tympani, right? Now, that's the tympanic bone. the rest of the petrous temporal bone. Yeah. All right, let us let's spend a little more time here on the squamous part of the temporal bone, and we all remember that this is an area that you have to know really, and this is the.
React them the surface mass, and they were supposed to do that for me.
Yeah. Okay. All right. We have the pterion, right? Okay. The pterion, as we know, is the junction of the temporal bone, the squamous temporal bone. The parietal bone, the squamous temporal bone, the greater wing of the sphenoid, and the frontal bone. And we can see that nice H shape there, right? Okay. And we saw last week that that H shape represents the middle meningeal artery, which comes up through the foramen spinosum here, right? And it has two branches, an anterior branch and a posterior branch. Sorry. The anterior branch, right, running here. That anterior branch sometimes tunnelizes the bone, as Mr. Gardner was mentioning to you last week, okay, and here it is actually coming through a little tunnel here, and then it's going to continue upward onto the parietal bone, okay. Sorry, just this one anteriorly, okay. Now, sometimes this part of the bone here is very thin. I'd like to hold it up against the light and show you, but if you have a skull and you look at it, you'll see it's very thin bone. And this is very easily fractured by a kick or fall or something, okay? And that can, as we mentioned last week, can give you an epidural hematoma between the bone and the dura mater, right, okay? And as we say, as Mr. Gardner mentioned, that dura is the periosteal part of the dura is continuous with the sutural, the fibrous tissue in the sutures, right? Okay, and so if we're stripping that external that dura mater, then we're going to strip up to where the sutures are. Okay, so it's contained to the bone that's fractured. Okay, and as we said, it will be a sort of lens shape. It will look like a lens shape. It's convex and sort of lens shape on when we do a CT scan or MRI. Okay, because it pushes into the brain and it's limited by the sutures of that bone. All right. Now, very important point Dr. Ludenke is asking me to mention here is the surface marking for the pterion.
For them to tell us, ask them to check it out.
So he wanted somebody to tell us. Who is going to tell us what the surface marking for the pterion is? Anybody?
Somebody must have checked that out. I thought it's very important because surgically, that's where.
Well, yeah. I just have and we can just estimate from what I'm doing here. We have two fingers. Yeah. We have two fingers above the zygomatic arch here, and you can see two fingers taken here. And if we put one finger behind the frontal process of the zygoma here, right, we see we're back there again, okay? All right, okay, so that's a good, the surface marking, if you don't have a tape measure, that's a good way to so one finger breadth, or one thumb's breadth, really, behind the frontal process of the zygomatic arch, and two fingers breadth above the zygomatic. Sorry, the frontal, one finger breadth behind the frontal process of the zygoma, and two fingers breadth above the arch. And that's, if I remember my it's 4 by 3 centimeters.
Yeah, 4 by 3.
4 centimeters superior, right? Okay, to the zygomatic arch, and 3 centimeters behind here. Very important, because you may, well, hopefully there'll be somebody around who can help you. A lot of places they're general surgeons, and I've worked in an island already where I've had to put a borehole in there, and just went back to my little training in neurosurgery before, right? Okay, because there was no neurosurgeon around. That person had an extradural hematoma. So if you're trained in general surgery, you'll be called on from time to time to put a borehole in this point, okay, and release the blood. patient improves dramatically, and then you can extend the borehole and try and find the actual bleeding point and tie it off. All right, okay?
Sorry. Those of you like myself who love to watch the English Premier League football, over the weekend on Saturday, the leaders Chelsea were playing Hull City, and the Chelsea defender clashed head with Ryan Mason from the opposition, and the guy apparently lost consciousness briefly, but he woke up quite well. So he had a lucid interval, but they took him to the hospital, and x-rays showed he had a fracture there, and he had to have this done, and he's now making much improvement. To see where it's important. You guys probably in desperation, like you're in the island, you might be the only doctor around, and you might have to do this on the local, because when the guy is flat out, he's not going to complain. And
it's actually quite a dramatic procedure. The patient improves quite quickly, right? Okay, so. And you understand the lucid interval, eh? Initially it was just a mild concussion, right? And then afterwards, as it bled, then they start pressing on the brain, and that is a very important surface of the brain right there. Okay, okay, okay. If it's on the left side, it'll be right over your Broca's area, which Mr. Gardner is going to show you. All right, okay. All right, so that's the pterion. Okay. Now, while we're on the zygomatic arch. The zygomatic arch is formed by two parts. It's the zygomatic process of the squamous temporal bone and the temporal process of the zygomatic bone. And this is the suture here, the fissure here, fissure. All right, if we go up here now, right, okay, we come to the, I hadn't touched much on this last week, so I'll go, I know you've done it already because you've done the temporal fossa already, but if we come up, if you feel on this bone, which is very prominent above the zygomatic arch, right here, you can actually palpate the suture, and that is the frontal zygomatic suture, right here, right, okay? So you can actually feel that area right there, right? If we go from that, then we come to this line, right, okay? And we follow this up, and there's a line here called a temporal line, which is really two lines. There's a superior temporal line, which is going to, it doesn't, not quite obvious at the beginning. It's as you get further, we can see here it has a superior and an inferior temporal line, okay? So here they sort of merge together, but as you get back, you start to see a superior temporal line and an inferior temporal line. And I know that you've done this already when you did the temporalis muscle and the temporalis fossa. But the temporalis fossa is bounded by the external line here, the outer one, okay, and then it goes down as far as the zygomatic arch and anteriorly to the frontal process of the zygomatic bone, okay, and this external line or superior temporal line will go right back and come back to the supramastoid crest that I spoke about. And this inferior, no, sorry, that one phases out, that one phases out a little, right, because the inferior one, that goes back here. This inferior one goes back to the supramastoid crest. As I remember this supramastoid crest here. And that's the attachment of this temporalis muscle, the inferior line, the superior line. Okay. So I'm going to hand you over to Mr. Gardner now, all right, okay?
Thank you. You like you always have to have us for transition. You don't want to. You have to have what?